Okay, guys. So today we are going to learn on the features of metastatic carcinoma of the thyroid to the femoral head. So this is a section or tissue from the femoral head. As you can see, there's a lot of bony trabeculae, and the marrow spaces is a bit fibrotic and contains a lot of fatty tissue. So this is a usual findings in elderly, in which all of the hematopoietic cells were then replaced with fatty tissue and fibrotic tissue. So this is just aging processes. So we have a look at higher magnifications. So you can see this is a very nice bony trabeculae. You can see the lacuna, in which it contains a lot of osteocytes, in which it's produced all of the osteoid or calcified materials to make up a bone structure. So all the empty spaces here is of the lacuna, which contain osteoid, and you can see the osteoid is very nice. It's appear to be like a lamellated osteoid, like an oil paint. If you do an oil painting, you can see the stroke of the paints on the canvas is like this osteoid. So it builds from time to time, so you can see all these osteoid. So in this area is actually where the marrow spaces are, and currently have been replaced with fatty tissue. You can see the vacuolated there areas there is actually the fatty tissue, and at the center here is currently one large capillaries. The center contains a lot of red blood cells, forming sort of a vague ruler formations with adjacent fibrin at the side there. Okay, so we're back to low magnification, so easier for us to screen through these slides. So as you go along, you can see majority of the marrow spaces is replaced by the fatty tissue, and at this point you can see there's increased fibrosis here, and there's some bony trabeculae that had been destroyed or become necrotic here, in which signifies something. So we have a look. So here you can see there's some bony trabeculae had been fragmented due to something must have been causing this. Higher magnification, you can see there's also necrotic bony trabeculae. The necrotic one is the one with a deep pink, or sometimes can say magenta like color. So that is the necrotic bone. How does it look like? And adjacent here is one fragment which is still viable, but in a fragmented manner. Most probably there's some recent fractures that occur to this patient due to something. Okay, that's interesting. So we have a look at a few other areas, and you can see there's a lot of fibrosis here. So fibrosis is just increase in the amount of number of fibroblasts and also fibrocytes. Like so, you can see there's a spindle cells there with elongated nuclei. The nuclei is the hyperchromatic one, arranged in a long fascicles manner with a lot of vessels or small capillaries or small arterioles within the fibrotic tissue here. So you can see there's still red blood cells to help you identify the vessels. And as we go along toward this, within this fibrotic area or fibrotic space here, you can see there's some gland or follicles-like structure here. It has a gland-like structure with cells, epithelial cells lining and surrounding it. So just for a quick quiz, what does this structure reminds you? I will give you 5 seconds to refresh back your memories and think of one organ or one tissue that might have similar features like this one. So the answer is the thyroid. You can see there's some atypical cells forming a follicles-like structure with some secretion within the luminal or within the at the center of the follicles, which is pinkish in color, and the cells that lines these follicles is somewhat having a mild to moderate pleomorphism there. Sorry about the color, it's auto tuned. Alright, so we're back to our structure here. So you can see all of these somewhat looks like thyroid follicles. So it is a very rare for thyroid follicles to, not rare, it's actually impossible for thyroid follicles to be present at the femur marrow spaces here, unless it is a malignant kind of tissue which metastatic to this area. So based on this is what we identify it as malignant thyroid tissue, metastatic to the femoral head. And if you see the broken bones over here, broken and also necrotic bones, bony trabeculae over here, so it signifies there are some fractures going on. So most probably the fracture is a pathological fracture due to the weakening of the bone structure because of the presence of the metastatic thyroid follicles here. So what type of thyroid follicle, thyroid carcinoma that might be having in this patient? So it could be a follicular carcinoma type, because if you see the nucleus is somewhat round in shape. It does not has any nuclear inclusion or nuclear grooving, prominent nuclear grooving, or any features that suggests it is a papillary thyroid carcinoma. So it's still a well differentiated thyroid carcinoma. In this case is the thyroid follicular cells. So because of this patient hasn't been diagnosed to have a thyroid carcinoma previously, so what we need to do is to do some immunostain to help us to identify where are the primary sites. Even though the features does look like a follicular carcinoma of the thyroid, but we still need to rule out other causes that might come or might mimic the features of thyroid follicular carcinoma features. So the first thing that we need to do is the CK7. The CK7 will help us in narrowing down which is where are the primary site for this tumor. So in this case, the CK or the Cytokeratin 7 staining is positive. You can see all of this all of the thyroid follicles, the carcinoma that presents within the marrow spaces do pick up or do stains with Cytokeratin 7. So next stain is CK20. So this will also help in to help us in narrowing down and to determine which are the primary sites. So in this case, CK20 is negative. And the last stain that we do is the TTF1, which is or the thyroid transcriptase factor 1, and this stain will help determine that it is directly from the thyroid. So in this case, the stain is not that good. This is most probably due to overfixation of the tissue. So, but however, you can see there's some faint staining of the nucleus that can be seen in this case. So, to conclude, this thyroid tissue, this case is a case of a metastatic thyroid follicular carcinoma to the head of femur, which caused pathological fracture in these patients. So with that, thank you and have a nice day.